हेलो दोस्तों, वेलकम टू मिस्टर वैभव भोसले प्रेजेंट नर्सिंग ज्ञान। और आज के इस वीडियो में हम देखने वाले हैं 20 इंपॉर्टेंट MCQs अबाउट प्रेगनेंसी एंड एंटीनेटल केयर विच इज़ ऑल्सो इम्पॉर्टेंट फॉर स्टाफ नर्स एग्जाम लाइक DMER, DHS, CHO, EMS and so more. So without wasting a time, let's start with the video. And here we start with question number 1. Which hormone is primarily responsible for maintaining the pregnancy? Options are estrogen, progesterone, oxytocin and testosterone. And the correct answer is option B, progesterone. Because progesterone supports the uterine lining for implantation and reduces the uterine contraction to prevent the premature labor. So progesterone is responsible for maintaining the pregnancy. So the correct answer is option B. Question number 2. What is the normal duration of full-term pregnancy? Options are 32 weeks, 36 weeks, 40 weeks, 44 weeks. And the correct answer is option C, 40 weeks. A full-term pregnancy is approximately 40 weeks measured from first day of last menstrual period. So on average it is 40 weeks. So the correct answer is option C. And the question number 3. Which of the following is a common symptom of early pregnancy? Options are frequent urination, weight loss, reduced appetite and skin dryness. And the correct answer is option A, frequent urination. It increases blood flow and hormonal changes and can put pressure on bladder, so causing the frequent urination, which is the common symptom of early pregnancy. So the correct answer is option A. Question number 4. What is the role of folic acid during pregnancy? Options are preventing diabetes, preventing neural tube defect, reduces nausea and increasing the blood pressure. And the correct answer is option B, preventing neural tube defect. Folic acid is essential for development of fetal nervous system, particularly during the first trimester. So the correct answer is option B. Question number 5. Which trimester is generally considered the safest for most medical procedure? Options are first, second, third and fourth. And the correct answer is option B, second trimester. It is considered the safest because organogenesis is complete and the risk of miscarriage is also lower. So the correct answer is option B. Question number 6. What is the primary function of placenta? Options are produce milk, protect the fetus from injury, supply oxygen and nutrient to the fetus and facilitate fetal movement. And the correct answer is option C, supply oxygen and nutrients to the fetus. The placenta acts as a life support system, providing the essential nutrients and oxygen while removing the waste. Question number 7. Which of the following is a risk factor for gestational diabetes? Options are low BP, high BMI, excessive exercise and low calcium intake. And the correct answer is option B, high BMI. Obesity and high BMI increases the risk of insulin resistance and it leading to the gestational diabetes. So the correct answer is option B. Question number 8. What is the primary purpose of ultrasound during the pregnancy? Options are pain relief, nutrient supply, monitoring fetal movement and enhancing fetal growth. And the correct answer is option C, monitoring fetal movement. Ultrasound provides the real-time imaging to assess the fetal growth, defect abnormalities and monitor pregnancy progress. So the correct answer is option C. Question number 9. Which vitamin is most important for bone development in the fetus? Options are vitamin A, C, D and E. And the correct answer is option C, vitamin D. It aids in calcium absorption and essential for fetal bone development. So the vitamin D is important for fetal bone development. Question number 10. What is the condition of high blood pressure during the pregnancy is known as? Options are diabetes, preeclampsia, anemia, and hypotension. And the correct answer is option B, preeclampsia. It is a pregnancy complication characterized by high blood pressure and potential damage to the organs like liver and kidneys. So the correct answer is option B. Question number 11. Which test is commonly used to detect pregnancy? Options are blood pressure test, glucose tolerance test, urine test for HCG, and cholesterol test. And the correct answer, as we all know, option C, urine test for HCG. Pregnancy test detect the human chorionic gonadotropin hormone produced after implantation. Question number 12. What is the purpose of glucose tolerance test during pregnancy? Options are detecting anemia, checking blood pressure, diagnosing gestational diabetes, and measuring vitamin D level. And the correct answer is option C, diagnosing gestational diabetes. This test measures how well the body processes glucose, which is crucial for detecting gestational diabetes. So the correct answer is option C. Moving towards the question number 13. When does the embryo become fetus? Options are 2 weeks, 4 weeks, 8 weeks, and 12 weeks. And the correct answer is option C, 8 weeks. After the embryonic stage, that is first 8 week, the developing baby is referred to as a fetus. So embryo become fetus, it occurs in 8 weeks. So the correct answer is option C. The next question number 14. Which nutrient is essential for preventing anemia during pregnancy? Options are calcium, protein, iron, and vitamin K. And the correct answer is option C, iron. Iron is essential for producing the hemoglobin, which carries oxygen in the blood. So iron is essential to prevent the anemia during pregnancy. So the correct answer is option C. Question number 15. What is the recommended weight gain during pregnancy for a woman with a normal BMI? Options are 5 to 10 pound, 11 to 20 pound, 25 to 35 pound, and 40 to 50 pound. And the correct answer is option C, 25 to 35 pound. This range is recommended to support the fetal growth and maternal health. So the correct answer is option C. And the next question, which position is generally considered safest for sleeping during pregnancy? Options are on the back, on the stomach, on the left side, and sitting up. Options are, and the correct answer is option C, on the left side. Sleeping on the left side improves the blood flow to the placenta and reduces pressure on major blood vessels. So the correct answer is option C, sleeping on the left side during pregnancy is safe. Moving towards the question number 17. What is the amniotic fluid primarily responsible for? Options are nourishing the baby, regulating temperature, protecting the fetus, and both B and C. And the correct answer is both B and C. Amniotic fluid cushions the fetus and maintain the stable temperature. So it also protects the fetus and regulating the temperature. So the correct answer is option D. And the next question, what is the recommended daily intake of folic acid during pregnancy? Options are 100 microgram, 200 microgram, 400 microgram, and 600 microgram. And the correct answer is option D, 600 microgram. Pregnant women are advised to take 600 microgram of folic acid daily to prevent the neural tube defect. So the correct answer is option D, 600 microgram. And the question number 19, which of the following is not a sign of labor? Options are contraction, water breaking, nausea, and cervical dilatation. And the correct answer is option C, nausea. While nausea can occur, it is not a direct sign of labor like contraction or water breaking. So nausea, it is not a sign of labor. And the last question, what is the term for the first movement felt by the mother during pregnancy? Options are quickening, effacement, Braxton Hicks, and lightning. And the correct answer is option A, quickening. Quickening refers to the first noticeable movement of fetus, and it usually feels around 80 to 20 weeks. So the correct answer is option A, quickening. It is a movement felt by the mother. So here we completed 20 important MCQs of normal pregnancy and ANC care. So thank you so much for watching this video till end, and do subscribe to our channel Mr. Vaibhav Bhosle Present Nursing Gyan, and do like and share this video. Thank you so much once again for watching.